Thank you so much for tuning in. I'm Hannah Adamson. We interrupt our scheduled programming to bring you live coverage of Siouxland District Health's upcoming press conference addressing the first confirmed case of COVID-19 right here in Woodbury County. As we first reported last night at 10, what we know so far, the individual that tested positive for COVID-19 here in Woodbury is a middle-aged female between 41 to 60 years old and is a resident of Woodbury County. Now she's currently at home in self-isolation. Siouxland District Health will be holding a press conference to address that case, and that's set to begin here in just a few moments. We'll have complete live coverage of that conference right here on KCAU-9. We're now going to toss to that conference.
So as Kim had shared, we have a case of novel COVID-19 has been confirmed in a resident in Woodbury County. According to the Iowa Department of Public Health, the individual is a middle-aged female, which is between the ages of 41 to 60 years, and is self-isolating at home. This individual is not hospitalized. They are self-isolating at home. This is what we proactively prepare for. And when you look at this, at our diagram, as we have mentioned before, people have had questions about what happens after we have a trigger related to this first case. This first case is actually indicated here in the red circle, that one individual. As a result of this confirmed positive identification of this one individual, the role that public health plays is we begin to identify, and we have interviewed the individual to identify inside the yellow circle, which meets the definition of a close contact. We have determined that. We will be working with that, and we'll continue to look at that to see what that case and how many of those individuals there are. One of the things we want to ask the community, the cooperation, a lot of the efforts that have been enacted from the state level have been done to reduce the burden and the volumes of information needed from our healthcare community. They are very vital to the overall success of conquering this virus. And I think what we want to do is ask the general individual from refrain from calling Siouxland District Health Department to inquire if they're a close contact, and also medical providers and the hospitals. However, if you do have symptoms, we still encourage that, but to call in and say, am I a close contact, that is not an answer that we can provide. So we encourage you just to pay attention. We'll continue to share information. We've been preparing for this for a long period of time. Disease investigation, as outlined in this poster, is something that we do on a regular basis and with many cases. While this is the first confirmed case, we will acknowledge this is probably not our last case. These will probably continue, and as we ramp up testing, there's greater potential for more positives. However, we still need to encourage the residents to be individually responsible for the managing of this sort of situation and making prevention their priority. So one thing that we say is you need to be practicing that social distancing and staying home as much as possible. That's a common man. Our governor of the state of Iowa has put in measures that's restricting people's ability to congregate in groups of 10 or more. You need to monitor as an individual, and if you are the parent of children, to be paying attention and also encouraging them to comply with that. We think that that's important. You need to wash your hands frequently with soap and water for about 20 seconds. Cover your coughs and sneezes with that tissue, the elbow, the upper arm. Staying home when ill, and also routinely cleaning frequently touched surfaces such as doorknobs, light switches, countertops with an effective cleaner. We figure that about 80% of Iowans infected with the COVID-19 should experience only mild to moderate illness. Most of these mildly ill Iowans may not need to go to their healthcare provider to be tested or confirmed that they have COVID-19. Sick Iowans must stay home and isolate themselves from others in their house until these conditions exist. You've had no fever for at least 72 hours. That is 3 full days from the time the fever is gone without any assistance from ibuprofen, Tylenol, or any other fever reliever. Other symptoms such as cough, shortness of breath have improved, and at least 7 days from any symptoms originally appearing. If you do need to visit a healthcare provider or your symptoms are there and they're getting worse, we encourage you to call, not to just show up. This has been the same message that we're looking at doing. What we are really looking at doing within the community is we've put these concepts into practice because this is what can reduce that spread and probably the prevalence of this in our communities. which then reduces the burden on our healthcare community. That's our priority of what we're looking at doing. I think one of the things in kind of reading some of those as far as an analogy of what we need to do is this is a virus we need to treat with concern. We need to treat it with respect, but we do not need to treat it with panic. I think individuals, we need to assure you that there are many things going on behind the scenes that we're working at doing to protect all the individuals of Woodbury County, and all of these mechanisms on prevention are actually strategies that are suggested to reduce the spread if this becomes more prevalent within the community. For up-to-date information, there is a website we'll be distributing. This is through the Iowa Department of Public Health. We'd appreciate your work in supporting that. We think Iowans are based. They like to get information. This is a factual information that exists. And we just want to make sure that that's the information that is available to our public. So that is we have that confirmed case. We're conducting the investigation, as I mentioned, and we're following up at this point in time. Also, I need to be assured with you there is limited information we can share about the case because we need to protect their privacy. So that is the questions that you may ask. We may not be able to give detailed information, but this is about the recommendation and the protection of the privacy, much as all of us would expect in any sort of issue or situation that we are medically facing. So we do want to be respectful of that. So at this point in time, I would open up for any questions from any of the media that are present or online.
Kevin, could you say this is a case where it was someone that traveled, or would this be a community spread, or do we not know that?
I'll let Tyler Brock actually kind of answer that. The question is if this is related to travel or community spread. So Tyler Brock, Deputy Director, will respond to that.
The answer to that is possibly. Okay, there is travel associated with this person, but it is not able to be 100% determined that yes, this was the cause. That when we're trying to put this together, there's various pieces of the puzzle that you're trying to work with here, and I guess I'll say that not all the puzzle pieces are fitting exactly together perfectly, but the possibility of travel is definitely there in this case.
Okay, fair enough.
Are we able to know what city or town this individual is in?
The question was, will we be announcing which city or town they're in? No, we will not be. It is a Woodbury County resident. That is much as far as residential data that we can include, and that's the protection of the individual. Because we also know whether it's Sioux City or a small community, there's potential that word gets out and it may actually identify them. And our primary thing is to protect this individuals also. But as be assured that we are looking at those close contacts, we will follow up with those if anybody falls into that category.
So you're unable to say whether it's Sioux City or outside of Sioux City?
Correct.
Okay.
Yes, we are unable to say whether it is a Sioux City resident or a outside in the rural area resident in our smaller communities.
She's isolating at home. Do we know how she's feeling, what her condition is?
The question was asked about isolating at home and how they're feeling. The reason they're isolating home is because the symptoms that they're showing have not elevated to a need that they feel they need to seek medical intervention. I mean, they have been tested, so they have consulted with the medical provider. And that case, they did follow through with that. But yeah, as far as this, self-isolating home indicates they are manageable and that they're feeling comfortable with that status.
Do we know how long she's been experiencing symptoms?
Not really. In the interview is what it was. We have talked with them about the symptoms is what it was. And there are, because of the season that we're in, is what's related to this and what may be some other disease is what it would be. So I think we've just taken that into consideration. And those are things that we're putting together to the decision about that close contact identification.
That close contact investigation, now is that looking at places she's been before she was confirmed with that case?
What we are looking at in close contact, and the question is, at the close contact investigation, is it looking at places that this individual has been? Tyler, I think best kind of has the best, because he's the one conducting or working with that most directly.
It's a really good question, and it's obviously something that we understand is a primary concern. I will say that the primary focus of this, again, kind of referring to our chart here, is going to be those people that are most close to them. And primarily that's household contacts. Okay, we know that even though there is some variability with the symptoms and things like that of this case, we know that the vast majority of cases are infected by symptomatic people with close contact, prolonged close contact, and so we're going to focus on those people that are the closest. So again, we're going to really work on household contacts primarily, and we're not going to focus a whole lot on workplace exposures, shopping exposures, and things like that. It might be a little bit hard to understand why we're going down that road, but again, I just want to repeat that the vast majority of cases are spread through prolonged close contact. Again, not every single case in every single situation, but the vast majority of the folks are in that realm, and that's where we're going to spend the majority of our time. Again, if you think about a particular workplace situation, very rarely are you sitting at your work face to face with something, this close. We almost always have a certain level of personal space that comes along with workplace situations. And so workplace situations are going to be low risk situations, okay? And so again, just to repeat, we are going to be focusing on household contacts as far as the primary people who need to be taking action because of this.
What does this mean for the general public? Like what steps should people be taking that are different, if any?
There really are no recommended, as Tyler mentioned with this case, and that's one of the things I need to emphasize. When we're looking at close contacts and who's identified potentially with that, that is a case-by-case decision. So there may be a change that when case number 2 comes through that we may have to do something like that. The likelihood of it is not great. But I think that's one of the things that we need to recognize when we're looking at this. So we will then, that close contact definition is pretty consistent, but the parameters it involves related to who does for notification might be on an individual basis, the workplace there's potential for that. But right now at this point with this case, it is primarily those household contacts that we're working with. As far as for individuals preventing, just as I outlined within the steps, I mean, pay attention to when you are even in a checkout lane. If you've gone out to get those necessary supplies, pay attention in the checkout lane. Don't crowd. I don't quite care how busy it is. Keep an appropriate set of distance. The exposure likelihood is not that great, but you need to do on an individual basis what you can to personally protect yourself. If you are working with young people or even as adults, if you elect to congregate in places that have large crowds, because you have to understand Iowa's approach is a little different than South Dakota and Nebraska as far as grouping and what they made for recommendations with some of the restaurants and food establishments. But if you choose to go to those establishments, you may be not able to maintain the social distancing. So I think it's keeping track of some of that from a personal basis. But as far as that, the social distancing, small gatherings, which kind of has set the barometer at 10 or less, the preventative things, stay home if you're ill, is a primary thing. Sanitize some of the commonly touched surfaces. These are sort of, and that's a parameter that you would do even within your home in cold and flu season. Light switches, phones, doorknobs, what everyone in the family may touch, you may want to think about upping your sanitization with that. So we are not changing those prevention recommendations with the announcement of this first case. Those are good standard practices, and they're even more important to reduce sort of the implications and the impact this will have on our community.
Are you hearing much from our neighboring counties, partly because a lot of Woodbury County residents do work out of county, like many residents locally work in Plymouth County. Many residents locally would work in Ida County. GoMaco's told all their employees that they may have a case. So are you aware of any other Northwest Iowa cases? This is pretty much the first one for this corner of the state.
Correct. This is the first case in this kind of Northwest quadrant. Prior to this, the closest locations were Harrison and Carroll County. As far as the connectivity amongst the local public health agencies, we have that as far as with them in working to be able to kind of assure some coordination of services. But more importantly, our healthcare community is very well connected. They are constantly, we work in a regional healthcare coalition, and those relationships of familiarity, the information sharing, All those systems are set up that we can actually do within this. For right now, our current exists about a 5 to 6 county territory. And so if it goes beyond that, we'll expand that. But I think that coordination of those services is something that we have been planning related to something like this for a number of years.
Yeah, so, but you haven't heard of anything specific for, say, Plymouth or Ida or anyone?
No, those notifications, as far as with the disease notification, the question was, have we heard anything out of surrounding counties as far as fish? Sorry for the audience. I think what it's important to think about is that just as we were notified that this was a Woodbury County resident, Plymouth County Public Health, Ida County Public Health, Monona County Public Health, those local public health agencies will be contacted if they have a confirmed case. And they will then be putting in protective measures. One of the things, we may just ask them, we'll contact them to see if there's any support that we can provide. But as far as specific case information, that's their duty responsibility to make any announcements related to those. But that does not fall underneath our ability and our authority to do that. We strictly serve Woodbury County.
Are other people in Woodbury, are there other people that are getting tested in Woodbury County right now? Or?
Yes, there is current testing going on, and this is, as we have mentioned before, that are those individuals that have contacted their healthcare provider, and they meet the qualifications for that, as far as for criteria, I should say, for being tested. So there have been tests taken, they've been submitted. One of the challenges, because the volume of testing currently going on, is we're looking at 4 to 5 business days for sure before we can get those test results back. So over that period of time, that even re-emphasizes if you're ill, stay home, self-isolate, limit your contacts and that type of stuff, and also take the other preventative natures.
So the person in question was tested a week ago. How long have they been isolating?
The person in question was tested. I'll let Tyler respond to that.
Sure. The testing was done earlier in the week, and so that person has been isolating since then.
So like Monday, Tuesday?
During this week is when that was done.
Any other final questions?
Are you able to describe the nature of this person's work? What kind of work they do?
No, that's not any information that we're able to release. That would hinge upon their confidentiality and privacy. Any other questions? If not, in closing, once again, thanks to all of you, all of those that are watching remotely, for participating and viewing our press conference today. As I can't emphasize enough related to this, any potential contacts we will be getting a hold of, calling the health department is not going to help us in any way, just like the healthcare community with the fear of being overwhelmed and looking at what we could do to reduce. We also have limited resources. So we will be reaching out. And also, as a public health agency, we are in discussion for templates and formats for how we can continue to provide updates related to this so we keep our residents informed. We have that as a priority, and to allow them the information. And underneath all of this, even with the information coming out, we're asking people to approach this with concern, respect, and not panic. And I think that's the part that's going to serve us the best as far as moving forward and getting past this segment of our population or our history. So, no further questions. I want to thank you for your time today and for your participation. So, thank you.
Again, that was the Siouxland District Health press conference regarding the first confirmed case of COVID-19 right here in Woodbury County. They did interview the individual. Again, Kevin Grime there saying there's no need to treat it with panic. However, there is limited information available due to privacy concerns for that individual. Now, a statement, of course, from Kevin Grime reads, quote, Siouxland District Health Department has been proactively preparing for the likelihood of a positive test right here in Woodbury County. While this is the first confirmed case, it most likely will not be the last case that we will see, especially as testing for the virus is increasing. We encourage all residents to continue to make prevention a priority. Of course, those actions include, as they mentioned, practicing social distancing, staying home as much as possible, washing hands frequently with soap and water for at least 20 seconds each time, covering coughs and sneezes with a tissue or elbow/upper arm, staying home when ill, routinely cleaning frequently touched surfaces such as doorknobs, light switches, countertops with an effective cleaner. According to Siouxland District Health, approximately 80% of Iowans infected with COVID-19 will experience only mild to moderate illness. However, most mildly ill Iowans may not need to go to their health care provider. As Siouxland District Health did mention, if you have questions, if you have symptoms, then it would be better to call then. But if it's just a question as to whether or not you would be in close contact, they recommend staying away from calling hospitals right off the bat. As well, the key thing, sick Iowans must stay home and isolate themselves from others in the house until you've had no fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fevers, and other symptoms such as cough and shortness of breath have improved, and at least 7 days have passed since your symptoms first appeared. Again, if you think you may need to visit a healthcare provider, call first. Your provider can assess whether you need to be seen in the office or if you can recover at home. There may also be options for you to talk to a medical provider from home using technology. In addition, a public hotline has been established for Iowans with questions about COVID-19. That line is available 24/7 by calling 211. Of course, Siouxland District Health also mentioning you can also go to idph.gov for the latest information. Well, that will do it for the Siouxland District Health Conference here. Thank you so much for staying with us. We now return to our regularly scheduled programming.